Inpatient treatment for sex addiction was really the first modality for treating sex addiction. It's where you fly into the hospital location, you're in with a group of other addicts, and you live there for anywhere from 2, 3, 4, 5, 6, 8 weeks. And you have 24-hour nursing care. This is great if you have a dual diagnosis like major depression, bipolar, manic depression. They can help you with managing both of those at the same time. You will have exercise classes. You'll have support groups that you go to, usually on-site, sometimes off-site. You'll have a pool. Sometimes, many times these are mixed genders. So sometimes the wife is not that excited about a male sex addict sitting next to a female sex addict in a bathing suit. So you have to make sure that the treatment center has addressed those issues, or you have addressed those issues inside your marriage. Also make sure you find out if they involve the couple, the husband or wife, or not. Some do. Some have family weekends where the addict's there for 3 or 4 weeks. Then they spend a day or two with the spouse and doing some family work there. Just find out about those things. Those are the kind of the pros. Some of the cons to this would be it's very expensive. Tens of thousands of dollars. It can go anywhere from 20 to 50 to as much money as you want to spend. So it's very expensive, and make sure you know what the costs are up front and you're very in agreement with that, because it can be very, very expensive. The other downside of that is also sometimes the aftercare. Make sure that it's really clear what your aftercare program would be. So if you're going to do inpatient, there are a couple places, but make sure some of these treatment centers advertise sex addiction, and it's one group a week. Well, for one group a week, you can do that locally in some other kind of setting. You want to make sure that you're really getting several hours a day dealing with sexual addiction issues if you're paying that much money for sexual addiction treatment. So make sure that before you go, you get a schedule that you can look at to show you how much time you're in groups related to sexual addiction, because some of them treat general addictions, and you might get one educational group a week. So you deserve to do really good research on this, because it is really a major investment. And if you go inpatient, make sure that you know what you're doing before that. But it is one of the modalities for treating sexual addiction.